Hey friends, Mark here, your Mito Mechanic, and today I just want to do a deep dive into the clinical processes of how we manage a CIRS case. So I'm going to walk you through, start to finish, what we would do if you were to decide to work with us at the clinic, and just going to give you a good overview of the standard of care that we set here and why I think the level of detail that we bring to a CIRS treatment is second to none. The first thing I'll start with are the core values that myself and all of my team members bring to every single CIRS case. Those being care and mastery. And I feel those are of utmost importance in managing every single CIRS case. You can't just be a highly intelligent, highly skilled physician managing a CIRS case. You need to combine that level of mastery with incredible amount of care. I found so many CIRS patients just fall through the cracks. So if you're not being well managed, cared for, having check-ins with the clinic or your care team on honestly a weekly basis at the beginning of treatment, I would argue that that is probably the most important part of treatment, because what is going to happen is inevitably at some point along your treatment, something's going to not work. You're going to struggle with something. A recommendation made by your clinician is going to have an adverse reaction. And so if you don't have that extra level of care and attunement from the staff at the clinic that you're working with, you're going to get frustrated. You're not going to continue with the treatment. You might not book another appointment, and that's not what we want. So we want to have that really high level of attunement and care to you throughout every single step of the protocol. But most importantly, right at the beginning. That's where you need high touch, just all of us, all hands on deck at all times. So enough of me yammering about that. Let's get into how we actually set up a CIRS treatment here at the clinic. So if you're a new patient and you find us online, and let's say you book a discovery call, that's where everything starts. So we don't run blood tests without doing a very thorough pre-screening. So we don't recommend blood tests for everybody. If you are going to be recommended a blood test from us, we would like to see generally two things. We want to see positive symptom clusters. So on those 13 CIRS symptom clusters, we want to see 8 or more clusters that are positive for you, as that's leading us to suspect that CIRS likely is involved. And on top of the symptom clusters, we want to see a failed VCS test. So those two combined, the 8 or more symptom clusters combined with a failed VCS test, will give us about a 98.5% likelihood of CIRS. So if those are both positive, we would definitely recommend that you proceed with treatment. In doing the symptoms themselves, they're generally a little bit more complex than just going yes, no, do you have fatigue, do you have pain, do you have headaches, do you have red eyes, do you have blurred vision. So myself and my colleague Jane like to go a little bit more detailed and just review all of those symptoms with you in more detail, just so we can get a little bit more clarity of like, okay, so you say you're fatigued, but what exactly does that mean? What happens if you were to push it beyond, like you had a good day and you tried to do extra? What would happen the next day? How do you feel when you wake up in the morning? So just kind of probing each of those 37 different symptoms in just a few different directions, so we can get a little bit of a clearer idea of do you actually have fatigue or pains, and how are they showing up and manifesting for you? So we do this on a complimentary 30-minute discovery call with the individual. And once Jane or myself are confident that your symptoms and your clusters are indeed aligned with what we would see in a CIRS case, then and only then would we recommend that we go